Hi, my name is Chelsea Young. I'm a student at Winston-Salem University in the RN to BSN program. This is Health Assessment Class Nursing 3312, and today I'll be performing a complete exam on the thorax and lung system today. We have Madison Simmons with us today. I want to start by asking and making sure that I have consent to perform and record this exam today, as well as upload it online strictly for educational purposes. So, Ms. Simmons, do I have your approval?
Yes.
Okay, thank you. So first thing we'll be doing is collecting subjective data prior to obtaining any kind of objective data, okay? So I'm going to ask you a list of just standard questions that we use when assessing the lungs that could possibly lead to any problems with your lungs. So have you had any coughs lately?
Yes.
All right, when did it begin?
About 3 days ago.
Okay. Do you find that you cough more at any specific time of the day, like night or during
In the morning.
In the morning?
Mm-hmm.
Okay. Sometimes that could just be after being at night whenever your sinuses drain. It could just be collecting during the day. Do you cough up anything, such as maybe blood or phlegm or anything?
Yeah, phlegm.
Okay. What color is it?
It's green.
Okay. And that could indicate an infection. Are you experiencing any kind of shortness of breath now, or have you lately?
No.
No? Okay. Experiencing any kind of difficulties while laying down?
No.
Okay, good. Do you have to use any kind of home oxygen or inhalers?
No.
Okay, perfect. Have you experienced any kind of chest pain when you're breathing or on any kind of exertion like physical activity?
No.
Do you currently have or have you in the past had any trouble with your lungs?
With what?
With your lungs, sorry.
No.
Okay. Have you ever been diagnosed with emphysema, asthma, pneumonia, or tuberculosis?
No.
Are you a current smoker?
Yes.
Okay. How long have you been smoking for?
It's 6 years now.
6 years? Okay. How many packs a day would you say you smoke? You smoke a full pack, half?
About half a pack.
Half a pack? Okay. Have you ever thought of quitting?
Yes.
Okay. Are you around any kind of environmental conditions that could affect your breathing?
No.
Now, have you ever worked in a factory, a plant, a coal mine?
No.
Anything like that? Okay. And have you stayed up to date on your flu vaccinations?
Yes.
Have you been checked for TB skin tests?
Yes.
Okay. You get checked for those yearly?
Yes.
Okay, good. So now that we've completed compiling our subjective data, we'll go ahead and do the objective data. So we'll start by looking at your breathing. Okay, we'll inspect, make sure that you're breathing even, your chest is rising and falling appropriately. Then we will move on and I will palpate the lung fields. Okay, we will make sure that there's no tenderness noted, that there's even muscle tone, and we'll do that by palpating 6 lung fields here. And we'll go over, then we'll go down, and if you feel tenderness anywhere, you just let me know. And continue to go down. And on females, you try not to palpate over the breast because it can change your data. So palpation was fine. Now we will go on and we will check the resonance in her lungs. We will use the ball of our hand to make sure that we feel equal sensations with the patient saying 99 or blue moon. And in this case, we'll use 99. So each time I touch you with the ball of my hand, just go ahead and say 99, okay?
99. 99. 99. 99. 99. 99.
Okay. So now that was even. Nothing adverse was found at this time. Now we'll move on and we'll place our thumbs under the costovertebral space and make sure that the lungs are rising and falling appropriately. So just take a normal breath for me. Okay. And that too was normal. Nothing noted there. Now we will auscultate the breath sounds. We'll check all 6 spaces evenly to make sure that nothing is abnormal. So just take a nice deep breath for me each time I place it on your chest, okay? Good. And now was good. And normally we would use skin-to-skin contact and place a patient in a gown prior to this, but for this demonstration purposes, we leave the patient obviously in their clothing. So now that we've done the anterior, we will have the patient rotate and we will do posterior. So, and we will do the same thing. We will inspect the posterior to make sure that the lungs, the chest is rising and falling appropriately. We will make sure the shoulders are even, that one is not slumping to one side or the other, which in this case they are not. Everything looks symmetrical. We will now do a similar palpate to make sure there's no tenderness. So at any point, if you feel any tenderness, you just let me know. Anything tender? Nope. Okay, good. After palpating, we will check to make sure that the patient with the percussion is equal. So we will say 99 again. So every time you feel me touch, you just go ahead and say 99.
99, 99, 99, 99, 99, 99.
Okay. And that was normal. We will move on and we will do the same thing with the thumbs to make sure that the back is rising and falling symmetrical at this time. Go ahead and take a deep breath. Good. Okay. That was normal. So we will continue on and we will auscultate all 6 fields. Every time you feel me touch you with my stethoscope, go ahead and breathe in. All lung fields were clear at this time, so everything appears normal right as of now. If anything adverse were to be found, we would write that down and inform the doctor at this time. So I want to thank you for being a part of this demonstration today, and that concludes the examination.